listen-only mode.
Hello, my name is Karen Odegaard, and I am a community coach with the County Health Rankings and Roadmaps program. I'm joined by my colleague and fellow coach, Mary Bennett. Hey, Mary.
Hey, Karen, and welcome to all of you who are participating in this webinar, Action Center Refresh, Choose Effective Policies and Programs. During this short webinar, we'll introduce you to the Choose Effective Policies and Programs Guide, our first Action Center Refresh.
We also want to take the opportunity to hear from you today, so we will be incorporating a poll and some open-ended questions into our short time together, so keep your fingers at the ready. We want to hear your experiences as well. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. Thanks to their support, we're able to bring you this webinar today. The County Health Rankings model shows how we think about health. It tells the story that health is more than healthcare and that many factors contribute to how well and how long we live. This picture also shows us that the policies and the programs that we choose for our communities impact those health factors and ultimately have the power to improve health outcomes in our communities. We know that this work is challenging, which is why we've created the Roadmaps to Health Action Center. The Action Center includes people, tools, and practical resources to guide communities as they build healthy places for all to live, learn, work, and play. And it is grounded in the Take Action cycle. As your community moves through this process, you start by gathering information to assess needs and resources. You set priorities so that you can focus on what's important and find the most effective approaches to address your priorities and then get to work on what's important. And of course, evaluating throughout the cycle will help you improve your strategies and ensure that what you're doing is effective. Now, you'll notice that work together and communicate wrap around the circle, and that's because these are key components and they're present in every step that you take. At the heart of the Take Action cycle is people working together from all walks of life, because we know we can make our communities healthier if we all get involved. The Roadmaps to Health Action Center provides guidance and tools for each of the steps you see in the cycle. And Mary is going to actually chat out a link to the Action Center now. So when you get to the Action Center, and this is what I like to call my pro tip for the day, bookmark it. We want you to come back and visit us often there. So check out the Action Center, bookmark it, and come back and see us.
When you registered for today's webinar, we asked you about your experience with Action Center. Nearly half of those who registered, those of you who are participating today, are either unfamiliar with Action Center or have heard about it but not visited. So we hope today gives you a taste of what the Action Center can provide to help with your work. Many of you have been to the others of you have been to the Action Center, and about a quarter of you have used the guidance and tools. We're going to look to our more experienced Action Center visitors to share your thoughts about the Action Center along the way today. And so with that in mind, we'd like to hear one way you've used the Action Center in the past. So again, those experienced ones, we'd love to hear from you.
We like to start our webinars with a guiding question. This is something that we can explore together in our time together. And today we're going to be thinking about how the Roadmaps to Health Action Center can support your work. So let's move into that. Now, over the course of the next year or so, each of the Action Center guides will get a refresh. Our first refresh is to the Choose guide. The purpose of this step is to explore and select evidence-informed policies and programs to address priority issues. The guidance here answers questions like, how do I find possible policies or programs for my community? How do we know if a strategy will work? How do we decide what we do? And who should help us decide? What does this step look like in your community? So this is another opportunity that we want to hear from you. What is something challenging? What's hard about choosing effective policies and programs? So again, we gave you fair warning at the beginning that we wanted you to keep your fingers at the ready. So we'd love to hear from you. What is challenging about choosing effective policies and programs? So let's dive in. When you click on any step in the action cycle, you'll find a brief overview of that step and see key activities that make up the step. Choose is broken down into 7 key activities, beginning with define your goal. And we're going to take a closer look at those key activities. As you choose the policies and programs you want to implement in your community, you will begin, as we said, by defining your goal, getting clear on what you want and why you want it. You'll explore your options. Which policies and programs can help accomplish your goal? From there, begin considering the impact potential strategies can have in the context in which they will be implemented, including thinking specifically about your community and your stakeholders. And finally, select the best strategy. Think about the challenge that came to mind for you when it comes to choosing effective policies and programs. Which key activity relates to that challenge? So I see a couple of you have chatted in that it can be hard to compare how much work they're going to actually take to implement. I think that's a great point. And then thinking about special populations and what strategies are really going to work best for those special populations. I think that these are all really great and timely challenges that communities are facing. So I appreciate those of you who are chatting those in. So thinking about that challenge that came to mind for you and looking at these key activities, what makes the most sense to dive into? And if you are at your computer and maybe you're actually in the Action Center and you're following along sort of and you are taking a look at the Choose guide, go ahead and select the key activity that makes the most sense for you. If you're following along with me, then I'm going to take us into define your goal. So each key activity includes brief guidance and suggested tools, which you see here on the screen.
Yes, and Karen, I want to mention in terms of the suggested tools that many of the communities that I've worked have really found these helpful just to steer their efforts. And in particular, I'd like to know the tierless logic model. I know many communities that have found it helpful.
Great, thank you, Mary. Yeah, the tierless logic model is definitely one of our favorites. Okay, so as we refresh the action steps, we are striving to make some key improvements. First of all, we know that more and more communities are working to bring an equity lens to their work. And as we refresh our guides, we're working to add tools and guidance that give you some concrete ideas about how you can put equity into action.
And Karen, can you talk a little bit about what equity means in terms of what we're talking about today and the Choose Guide?
Yeah, I think that's an important question. So in this step, communities can really be thoughtful about who is helping make decisions about the strategies that they choose in their community, and then also thinking about the impact that strategies could have on those most affected by poor health. So those are just two things that come to mind right away when I think about where does equity fit into the discussion about choose. So to help, we've included some questions that you can ask as you consider potential strategies. We've also added a tool that's new to the Action Center. It is the Racial Equity Impact Assessment Tool, and it's from Race Forward, the Center for Racial Justice Innovation. You'll find this tool in the Consider the Impact key activity. And this tool can help you consider how different racial and ethnic groups will likely be affected by a proposed decision that you're making, a policy or a strategy that you're going to be thinking about. But I think this question is good. So what I'd like to hear from our audience again is, when we say putting equity into action and talking about some concrete things, what does that mean to you? And specifically, because we're always trying to gather ideas and share them out with other folks, what is one concrete way that you have put equity into action in your community? And if it's related specifically to Choose, that's fantastic. So we're going to watch for those. And just so you all know, we are seeing chats coming in, and we really appreciate that. So if we don't get a chance to bring all of these into our conversation today, they will be informing our work going forward, and we'll try to bring them into the conversation as well. So another key improvement is, we know that you're busy. That's why we have a 20-minute webinar, and that's why we have been working really hard to make the content of our guides less dense without sacrificing value. So we hope that you'll come to the Choose step, you'll easily find the key activity that best fits where you're stuck, you'll get in, you'll find the guidance or the tool that can help you, and then get back to it. One of the things that we try to emphasize with communities is that the Action Center is not meant to be absorbed all in one sitting. It's not something that you're going to print out and sit down and read. It's something that you, again, bookmark, and you come back and you visit us to find what you need in the moment. However, we have created a new shortcut for the Choose guide, and we will be using these with all of our action steps that we're calling a shortcut. And this is a 2-page PDF overview of the guide. So you can take your Choose shortcut with you, you can share it with your partners, and you can use it to discuss where you are in your work and what challenges you face. So you do have something that you can take with you right away to kind of give you an overview of the guide. And we've also heard from visitors that we have a lot of tools, that choosing which tool to use can be overwhelming. So as we refresh the action steps, we will be highlighting about 5 of our favorite, our sort of must-have tools, and those you'll find on the overview page. So for example, in Choose, we highlight What Works for Health. This is What Works for Health is on our site at countyhealthrankings.org, and it is a great starting place to find ideas to address your community's priorities. So what Works for Health is, if you're not familiar with it, is our evidence team searches out, assesses, and summarizes the best available evidence. They look for policies and programs that can help improve health behaviors, clinical care, social and economic factors in the physical environment. This information can give you a sense of what works, what might work, and what does not work. What Works for Health supports the use of tried and true strategies as well as innovative approaches to thorny problems. And I just noted that somebody had commented that one of their challenges is that evidence-based programs are all over the board, and they're everywhere, and you can find them all on all these different sites. So What Works for Health, again, is a great starting point. We've got right around 400 different strategies in What Works for Health, and you can get in and find some strategies that you may want to consider. We also really like answering the 3 key questions for advocacy campaigns to help you get clear on your goals. The 3 questions: what do you want, why do you want it, and who has the power to give it to you, are pretty simple questions. The answers may not be quite as simple, but it's a really great starting point. The links to all of these, by the way, are going to be on that Choose overview page. So rather than giving you links to all of these individual tools as we go, I want you to head into Choose and find those there. So the tierless logic model, Mary already highlighted this, is a fantastic tool to turn the traditional logic model approach into a user-friendly process. It breaks the process into a series of engaging questions. We think it's especially helpful as an early planning tool, but the questions can be useful at other points in the process as well. And the intervention planning matrix is a really helpful tool to map each strategies that you're considering, to map its level of impact. It helps you think about whether a strategy will impact individual people, organizations, or the community as a whole. Will it change the environment or existing rules to support healthy choices? So it's a really great tool to kind of get a sense at what kind of impact your strategies could have. And the last tool that we highlight in our top tools for Choose is the Policy Advocacy Choice Worksheet, which calculates a score to help you decide which policy or systems change has the best chance in your community. We like this particular tool for its rigor and its comprehensive nature, but it can feel complicated. So this is a really great tool to work through with one of our Roadmaps to Health community coaches. And you can contact us to talk with a community coach about how this resource can help your community. And again, you can find links to all of these tools in the top tools section of the Choose guide. Okay, we want to hear from you again. We're going to put up a poll right now, and we want to learn a little bit more about, here it comes, what types of content is most helpful to you? Now, I know that you may like a variety of types of content, but we would really like to hear what you think is most helpful. So we're gonna do this pretty quickly because we're getting tight on time. And I'm gonna, while you all are thinking about that, I'm gonna just preview the next slide that's coming. Is that we can't do this work of creating the Action Center and really making it valuable for you without your feedback. So we're going to be asking for your feedback in a couple of different ways. So heads up that that's coming. We're going to be encouraging you to use Twitter to give us feedback using the hashtag Roadmaps Action Center, emailing us via our website at countyhealthrankings.org. And then we're also hoping to, planning to send out a follow-up survey to those of you who are joining us today that you'll see in your inboxes in 4 to 6 weeks. So you can watch for that, and we'll be learning more there about how you are using the Action Center. All right, so let's take a look at this poll. I'm going to close it, and we'll see. This is very helpful to us. So it looks like community examples are really helpful, and tools are helpful, as well as some of those in-depth resources. So that's really great for us to see, and we are working to bring in more community examples, and we'll keep at it because it sounds like that's especially helpful. Great. So I just want to pop this up on the screen for a moment that we do want your feedback. We are right up against time, but I want to turn to Mary to see if she has any questions or comments that you want to share out from what we've been seeing come in.
Yeah, just again, thank everyone for chatting. People have been talking about some of the challenges have to do with convincing non-public health program leaders to give up what they've always done just because it's easier. Thank you, Annette, for that comment. And also just appreciation for really concrete ideas in moving their efforts forward. I think with time, that's probably all we have.
Great. Well, and I would say we can definitely use this Twitter hashtag to, if you have a question that we didn't get to today, feel free to tweet it using that hashtag, and we'll get back to you. You can also contact us via the website, and we look forward to any questions and any feedback that you have. And the feedback that you've given as we've gone along today has already been valuable. So we've got additional upcoming webinars, and you can find recordings for our webinars on our website. We always like to have some reflection questions. So think about who else you might want to share this information with, and what is one idea for action that you're taking from this webinar. I hope that you're going to bookmark the Action Center in your browser. And this program is the result of the contributions of many partners, and we list many of them here. And finally, we just want to thank you for taking some time to join us today. We do these rapidly, and we hope that we can bring you some information in a short amount of time that you can use going forward. Thank you so much for your time and for all of the work that you're doing in communities. Have a great day.